Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina, professor of University of Medicine, and I develop many non-invasive techniques, but one of the most important is about periorbital rejuvenation without skin resection, Blepharoplasty without skin resection. Today I'm going to talk about this patient that comes from Peru to receive periorbital rejuvenation. Periorbital is this, from the eyebrow to the malar area. All this is periorbital. This patient has an ethnical characteristic that is the hooding of the upper eyelid and the lack of voluminization of the malar area, this tear through, and the lower eyelid fat pads. We must think in periorbital rejuvenation in two parts, upper periorbital and lower periorbital. Here we can see this patient have almost no flaccidity of the upper eyelid. This patient have a lot of lower eyelid fat pads and the important tear through and the lack of voluminization. Here we can see the same. You can see important tear through. You can see laterally the lack of voluminization. And this is the patient, this procedure I perform under local anesthesia with sedation. It's a procedure that takes 30 minutes. This patient I perform my personal technique, that is removing the upper fat pad through stab incision, lower eyelid fat pad through transconjunctival incision. You can see here tightening and improving the skin with carbon dioxide laser. But also I put fillers in this area, and you can see how improve the quality of the malar. This patient is, I think, 5 days after the procedure. You can see here the malar, the action of the carbon dioxide laser. And this is the patient 1 month after the procedures. She sent me this picture from Peru, and you can see here how improved the malar area, how I remove the lower eyelid fat pad without leaving scars. You can see the position of the eyebrow and the tail, and I always talk about that my point of view, my goal in the aesthetic rejuvenation, and is an improve to make the patient look natural, younger, happy, than remove skin. And you can see 30 days after the procedure is a completely expression. This expression is completely different from this, and this rejuvenation is natural, no scar. And here you can see how improved the malar area, no tear through with the voluminization of the malar area, that in this patient I inject hyaluronic acid. Here you can see how it changed the distance from the tarsal area to the malar area, when it's not very aesthetic when the junction between the lower eyelid and the malar area is so low. Here we can see a shortening of the distance from the tarsal to the junction of this patient. Here in a lateral view we can see how improved this. And if you compare a beauty periorbital area, you can see it's a good position of the tail of the eyebrow and a voluminization of the malar area. the majority of the patients do not understand the importance of the malar volumization in the process of rejuvenation. You can see here, and this result is more comparable with this young and beautiful patient. In this view, you can see a sad, tired, old expression. Here is completely different, and you can see here the excess of the skin was tightened with carbon dioxide laser, and you can see a nice position. Here I write periorbital aging is a deflation phenomenon. This is a deflation in this person is not only for the aging process, is a racial process. Many young patients have this, and all these patients I need to produce malar volumization to have this result. But few patients understand this concept. I'm going to perform more videos because if I do not improve the malar, I do not get my objective, that is a very nice rejuvenation of the lower eyelid. Here I write with fillers, I'm narrowing the orbital frame. Narrowing is this: the orbital frame goes from here to here, and with the filler I'm narrowing the orbit like this. We can see here, like with the filler I'm narrowing, and here you can see this is an oval, vertical oval, and with the fillers how I'm narrowing this, and with the reposition of the tail I improve the expression. Here you can see the forehead is the foundation of the upper periorbital rejuvenation. This means that if I not reposition the tail of the eyebrow, I'm not going to get a nice upper periorbital rejuvenation. The cheek is the foundation of the lower eyelid rejuvenation. If at this patient I use carbon dioxide laser but I don't feel the malar area, I'm not going to get this result. And you can see with measurement and the technique that I developed from here, from the nose to the hairline, I do not remove skin at all in any case. I just use reposition with this by endoscopic procedure that I developed to leave very small incision inside of the hair. And here I use carbon dioxide laser, volumization, and my technique is recognized for the most important prestigious surgeon of the world, and also in Wikipedia appear my technique like no invasive procedure. I hope you enjoyed this presentation.